Presbyopia happens to everybody in patients at an age when they're at their maximum earning potential. So it's this huge opportunity which we need to take advantage of. I'm Dr. Anton van Heerden. I'm a cataract and refractive surgeon. I'm based in Melbourne, Australia. We were the first clinic in Melbourne to offer SMILE and Presbyond. We don't specifically target any population group or anything like that. We really want to provide the best surgical experience for every individual patient. So we offer laser vision correction as well as lens-based surgical procedures for presbyopic patients. So Presbyond is a fantastic opportunity to give patients a surgical solution for their presbyopia in the absence of cataract. So whether the patients are short-sighted, far-sighted, if they have astigmatism, Presbyond is brilliant because it treats the ametropia, it treats the astigmatism, as well as giving them extended depth of focus on the cornea. So it's really a fantastic solution to offer our patients.
The other eye. Which numbers look better now? My name's David Crotman. I'm one of the optometrists here. I've worked at this clinic for 4.5 years now. My role is to look after patients interested in having their eyes lasered and planning their surgeries and looking after them after their surgery as well.
Presbyopia really starts in early 40s and progresses until patients are in their late 60s. So that is a broad range of age groups. Presbyopic patients are generally in the highest point of their earning potential. So it is a good source of income. So the conversion rate for presbyopic patients coming for assessment is high.
Okay, so morning Kaz. So I'm going to check over your vision and talk to you about laser surgeries that are available. Okay, so firstly, what brings you here today?
Look, I'm just really keen to get rid of these.
So what sets Presbyond apart from LASIK monovision is the fact that we have an extended depth of focus. So by adjusting the amount of spherical aberration in the distance eye and in the near eye, it means that we have an excellent blend zone. So it means that your intermediate vision is excellent. And we know that everybody wants intermediate vision so they can look at their computer, they can look at their phone. If you just did monovision without extended depth of focus, you'd lose that intermediate zone. But by using the Presbyond software, we enhance that intermediate zone, which means patients have great distances across all vision. As long as they have realistic expectations and know that there's no perfect solution, we're giving them a good solution, but whatever we do, there's a compromise. If a patient is wanting a presbyopic surgical solution, the first question to ask is, do they have cataract or do they not have cataract? If a patient doesn't have cataract, well then we're going to look to see if they're suitable to have laser vision correction. And do they tolerate the monocular blur test in the phoropter? And if that's the case, then patients are going to be suitable to have Presbyond.
So the treatment called Presbyond, how it works is we leave your eyes more like that. Okay? So what we've done there, you should be able to see the letters pretty clearly in the distance now.
Absolutely.
Okay, and if I hold something near, you should be able to see the small writing there.
Yes, I can.
And so what I've done there is I've made this eye good for near, but it's blurred for distance.
Right.
And that eye is good for distance.
Yep.
And not so good for near. Okay.
Okay.
But overall, if you look ahead, your vision's still pretty great.
Yes, it is.
And as a comparison, so if I take that away now, that's how you normally see the world. Okay. However,
so the most challenging aspect of Presbyond is the assessment and workup of patients to make sure you do that as accurately as possible. We need to make sure that we standardize our assessment process, we standardize our refraction process, so we all refract the same across our clinic amongst all the clinicians. We also make sure that the message that we're sending out to patients is the same. So we want to standardize our practice across the board, which is definitely the most challenging part of setting up a Presbyond practice.
I'm there already as well. I've had this.
And now we're using refractive workplace in order to do our surgical planning and to transpose that information onto the MEL 90 in order to do the surgery. So just checking on the manifest refraction on this patient on the right eye. The right side is aiming for distance, the left eye we're going to be treating for near, and that information is already in there. So keratometry is in, we've got the pachy in there, we've got the spherical aberration, most important on both sides, it's been placed on both sides, and we have the optical zone, and so we're going to save and close. And by doing that, immediately the data which we've double checked is in the laser. Good, keep very still there. Laser starting in 3, 2, 1. Just keep as still as you can for me.
7 seconds.
7 seconds, that's perfect.
5,
Don't move.
4,
3, 2, 1, and perfect. Good. So in Presbyond, the VisiMax 800 gives me confidence that I can create the perfect flaps every time. We can do very thin flaps, 80 microns. I generally use a 100 micron flap for safety purposes, but you know, it's fast and accurate and very safe. Excellent, well done. Okay, there you go. We're going to leave that clip in there. We're going to swing the bed round to the second laser. Okay. So the workflow allows us to be safe and efficient. And you know, that helps us make sure that we get excellent results and that our turnover in patients is as efficient as possible. Yep. Alright, so what you need to do for me now. So the MEL's our excimer laser. It's the machine which creates the profile and gives us the ability to do Presbyond using the Presbyond software. Keep looking there. So just keep looking straight the whole time.
3, 2, 1.
Starting now. Very good. Just keep very still for me. That's perfect. We're going to get you up and out of here in a second. All right, well done. So one thing Presbyond does do, it maintains a degree of stereopsis, and it maintains the contrast sensitivity as opposed to intraocular lens surgery where you lose contrast sensitivity. And that's really one of the advantages of Presbyond, in that you maintain good quality vision across all distances. All right, so that's gone very nicely. Perfect. I'm very happy with that. Just explain. Patients who are not suitable to have laser vision correction or have cataract, well, then we can offer lens-based solutions. And we have trifocal technology, which is amazing, and I've been using it for years, and I still use the AT Lisa Tri lens all the time for my patients, and it gives fantastic results and drives patient referrals. TK stands for total keratometry, which includes the anterior and posterior cornea. Initially, TK was thought to be only useful in patients who had previously had refractive surgery, but there's no reason why you shouldn't be applying TK to every patient. So my default is TK. I apply it to all my patients unless they've got a highly unusual cornea. The information that we get from the IOL Master 700 is directly imported into EQ Workplace, which makes intraocular lens decision-making and ordering really easy, and it makes it risk-free. So we like to do all our surgical planning, whether it's intraocular lens planning or refractive surgical planning, on EQ Workplace and Refractive Workplace. I prefer just using two formulas, and that's the Barrett formula and the Z-Calc. So this patient is 63 years old. He came to me because he wanted to be out of his glasses. He's a tradesman. He's been climbing up ladders and feeling very unsteady when wearing multifocal glasses, so it's really uncomfortable for him and unsafe. So he wanted to get rid of his glasses. He's got cataract in both eyes, so we're doing cataract surgery. We're going to give him trifocal lenses. So on a ladder, he'll have good binocular vision. The planning's already been done. It's on the Callisto. We're just going to line him up, and once the lens goes in, I'll be able to get a really accurate alignment of the lens. Alright, and I'm using the Cortera 700 phaco system, which gives me a nice stable anterior chamber. See how stable this anterior chamber is with the Cortera. Beautiful. And we can call for the lens now. Very good. Beautiful. Very nice, smooth delivery. And now you can see my alignment there. It's very easy to line up the intraocular lens. So I've been using AT Lisa Tri lens for over 10 years now, and I've got just fantastic outcomes with it. I know that if I implant a AT LISA tri-lens, I'm going to give my patient excellent distance, intermediate and near vision. Great, well done.
Brilliant. Okay, so this is Scott. He had bilateral cataract surgery yesterday, and he had the LISA lens put inside his eyes. Let's see how you're doing then. So if you want to put your hand over your left eye to begin with, that's great. So if you look at the letters, so if I go there, can you make out what's the lowest you can read there, please?
UXYPH.
Brilliant.
So number one, patients want an outcome. So they want to know that we do a good job and that we do a safe job. They want to put their trust into us and expect us to do the best we can for them.
It's funny, isn't it? I can read it about there.
Yeah, that's okay.
The news columns in most of the daily papers.
That's fine. Can you make out that one there?
This is the smallest size type in general use.
Right, there you go. You said it. That's great.
Very good.
The best marketing tool for any surgery is results. So the word of mouth referrals, without a doubt, are our biggest marketing tool. And that's easy. As long as we get good results, you've got to embrace the good results.
So we performed Presbyond with her last year, and all going pretty well, as we can see.
And Karen, how are you feeling after the treatment?
It's unbelievable. Yeah, I can't believe how good it is.
Amazing.
Yeah, I've never had 20/20 vision, ever. Always having to take the glasses off, like to read anything, or, it was just a real distraction and a real pain.
Good. All right, have a few blinks there.
Come blink, can I?
Yep, blink a bit. Yep, good. That's perfect. I love being in the OR because I love operating on patients. I love giving patients great vision and getting great outcomes. It's what I do every day and I absolutely love it. It's been awesome, guys. Thank you very much. I better get back to it.